My name is Tim Babcock, and I'm the Director of Development for the College of Health Sciences. It's great to see everyone. We thank you for your time this afternoon. We hope to make this just one of many future conversations related to health, healthcare, and the role of our college. On behalf of URI Foundation Alumni Engagement and the College of Health Sciences, I'd like to welcome you to our Dean's Forum, from anxiety to Alzheimer's and everything in between. The goal of this program is to bring attention to the accomplishments of the college and its faculty. We will provide insight about how the college is prepared to address the ever-changing myriad of health-related issues today and in the future. Our virtual audience includes alumni and friends from around the country, including President of the University of Rhode Island Foundation and Alumni Engagement, Lil O'Rourke, and Vice President of Alumni Engagement, Michelle Noda. Thank you for joining us. This is a milestone week for the College of Health Sciences and the university as we celebrate URI's Day of Giving on Thursday. This provides an opportunity to help students in need. As you can imagine, there are many, through immediate support. We will share more on that later. Please note that this program is being recorded for future viewing. We welcome your questions, so please submit them in the chat box where Amy will be monitoring them. Now I'd like to introduce our Dean, Gary Liguori, who joined URI in 2016 as College of Health Sciences inaugural Dean and now begins his 5th year as Dean of the college. Dean Liguori has 25 years of experience as a university instructor, professor, and researcher. Prior to joining URI, he had been the head of the Department of Health and Human Performance at the University of Tennessee, Chattanooga, and previously served as faculty at North Dakota State, Youngstown State, and the University of Wyoming. Dean Liguori's research focuses on such topics as physical activity, nutrition, obesity, physical assessment, and cardiac rehabilitation. He has been published widely in academic journals over the past 20 years and sits on the board of various national and global health and medical organizations. I'd like to welcome Dean Gary Liguori.
I'm pleased to be here today to share exciting updates about our college and to provide the opportunity for a few faculty to share their expertise. As Tim mentioned, the College of Health Sciences is new, now beginning only its 5th year. You all received an invitation since you're alum of the college, or at least the department you graduated from is now within the college. Those departments are physical therapy, psychology, nutrition, human development and family science, communicative disorders, kinesiology, and our newest program, or newest department, health studies. Just for some context, psychology, by way of student enrollment, is the largest program on campus and also produces the most PhD students each year. Kinesiology is also large, usually one of the top 2 or 3 programs on campus. So our college, Health Sciences, is large. In fact, it's second in total number of students only to the College of Arts and Sciences. But we're also friendly and intimate, with many small classes, lots of experiential learning, and amazing faculty-led undergraduate research, which you'll hear more about later. Further, the college is part of a larger consortium known as the Academic Health Collaborative, or AHC. The AHC consists of the colleges of nursing, pharmacy, and health sciences and exists to push innovation in health and healthcare delivery, education, access, and outcomes. The AHC works very closely with many state, public, private, and government agencies. Today's title is A to Z. Why A to Z? Well, that's the nature of our college. We're both broad and deep, and in fact, the depth and breadth was one of the key features that attracted me to URI initially and has me excited every day to come to work. Today, you'll hear from faculty with expertise in children, adolescents, and older adults. The beauty is all 3 of them can and do collaborate, particularly since life doesn't happen in a vacuum-exclusive age group. It's one long continuum. We know, for instance, that early life exposure or lack thereof can have profound lifelong impact, sometimes good, sometimes not. Therefore, in our college, instead of just looking at older adults with Alzheimer's, for instance, we also look for markers far earlier in life that are predictive of later problems. Maybe an inability for a child to learn how to read. And how can we intervene to mitigate dementia or some other concerns later in life? This is just one example, and we plan on hosting more of these forums in the future so you can see other examples of the great interdisciplinary work we do in our college and with other colleges and universities. Now I'm pleased to introduce Dr. Lisa Wyan. Dr. Wyan is a professor in psychology and also the director of the URI Interdisciplinary Neuroscience Program. Dr. Wyant completed her BS at Penn State University, where she recently received an alumni award from the College of Health and Human Development. Dr. Wyant was a Rotary International Ambassador at the University of Oslo in the neuropsychology program, and then received her PhD in school psychology right here at the University of Rhode Island with a specialty in neuropsych. Her research interests include the study of pharmacological and non-pharmacological interventions for ADHD in children and young adults, misuse of prescription stimulant medication, clinical neuroscience, and the study of executive functions in clinical and non-clinical populations. As Director of Neuroscience, Dr. Wyant oversees URI's most exciting new academic major, the Bachelor's of Science in Neuroscience, which launched this fall under unique circumstances, yet already has nearly 50 students enrolled with many more waiting. The College of Health Sciences is one of the primary homes for neuroscience at URI, and we are thrilled and proud to have Dr. Wyant leading the way. Today, Dr. Wyant will discuss both ADHD and neuroscience. Dr. Wyant, thank you for taking the time out of your busy teaching schedule to share with us.
Maybe many of you have heard that prescription stimulants, although they can change the lives of individuals with ADHD, are often commonly misused among college students and high school students. And so that's been a big focus of my lab, is trying to understand why do adolescents and young adults who don't have ADHD misuse, why do they take Adderall? And we know the number one reason is because they think that it improves their brain functioning. If they think that it makes them smarter, they think that it makes them perform better academically. So we've tested that. We've actually, myself and a colleague at Brown University, have given Adderall to healthy college students who don't have ADHD. And we explored, hey, does this actually improve their functioning or not? So I'm happy to answer any questions about that you might have. I'll close with saying the next step in our research, hopefully, is to find ways to decrease prescription stimulant misuse and to increase the interdisciplinary research across campus in neuroscience. I'm proud to say in our neuroscience program, we offer a PhD, we offer a master's, and we offer a certificate program. And as Dean Liguori said, we're thrilled to be offering an undergraduate Bachelor of Science degree in neuroscience this year across three colleges. Again, I can delve into that more at the end if you have questions about our neuroscience program. So thank you so much for taking the time to listen to our work. And now I'm pleased to introduce my colleague, Dr. Sue Adams. Dr. Adams serves as a professor and chair for human development and family science here at URI. She received her PhD in clinical psychology from the University of Massachusetts in Boston. Her research and clinical interests are focused in the area of physical and mental health promotion. She's a licensed psychologist, and she's also the author of the book, Family and Community Health, A Developmental Approach. She's past president of the New England Psychological Association, and today she's going to discuss issues surrounding early childhood health. Thank you, Sue, for taking the time out of your busy schedule to be with us, and we look forward to hearing what you have to say.
Well, thank you, Lisa, for that lovely introduction. Hi, everyone. So human development and family science is an interdisciplinary major, and we really work to train students to work in a variety of different human service fields. We also have faculty from a wide array of disciplines, including human development, couples and family therapy, social work, family finance, psychology, and early childhood. So today I'm going to talk about some of the work that our department is doing in the field of early childhood and child development. So a little known fact is that our department actually houses 2 community-based laboratory preschools. We have the Kingston Child Development Center on our main campus, and then we have the Dr. Pat Feinstein Child Development Center on our Providence campus. And we are very proud of the fact that the 2 preschool programs are among the highest rated preschool programs in the state of Rhode Island. Our CDC teachers are state leaders in the provision of play-based and developmentally appropriate early childhood education and care. And our CDC teachers are also experts in mentoring adult learners. And this is important because our teachers need to be able to teach both 3, 4, and 5-year-olds, and then also college students of all ages. So our CDCs are an integral component of our academic teaching of child development. We have students from across URI who do practicum courses in our CDCs. I would say probably about 100 students per semester. And when they're at our CDCs, they don't only learn about early childhood teaching per se, but really they are learning how to work with children. They learn how to talk to children, how to comfort children, how to teach children to develop problem-solving skills. They teach children to self-regulate, how to develop control over their emotions. And our college students also get to see our teachers and our directors work closely with families to help families manage their own worries and concerns about their children's development and the things that may be happening in their families. We also have faculty who teach students about research by using the CDC. So for example, one of my undergraduate students right now is running a study to examine stress and anxiety in parents who are sending their children back to preschool for the first time since the pandemic in March. And as any parent knows, there is a lot of uncertainty right now about school. So we hope that this research really helps preschools to target interventions and/or simple communications that help parents feel more secure and more at ease with sending their children back into the school environment. So now I'm going to transition to talk a little bit about some of the recent grant work that we've been doing. So over the past few years, we've been fortunate enough to be funded by the Rhode Island Department of Human Services and the Preschool Development Grant to expand our outreach throughout the state. So this funding has allowed our CDC teachers and HDF staff to train over 300 early childhood teachers and assistants across the state of Rhode Island. And the goal of this work is really to make it easier for the early childhood workforce to access tools and training that they need to deliver high quality programs. So why do we do this? One of the reasons, or one of the ways that we do this, is that we provide regular professional development workshops across Rhode Island. All of these workshops are approved for continuing education credits with Rhode Island's early childhood accrediting body. This increases the likelihood that teachers will attend our trainings, which is always a good thing. But the grant has really allowed us to deliver these workshops on a much larger scale. Another source of outreach that we regularly offer is allowing preschool teachers to come into our CDCs and observe high quality preschool in action. So in Kingston, if you can picture it, we have what we call an observation deck where people sit above the classrooms and then they can look directly down into the classrooms to watch what's happening in the rooms. And in Providence, we use more of an immersive model where observers actually go inside the classrooms with the teachers and the children. But the grant support has actually allowed us to extend this to offer virtual learning opportunities, but also give our teachers some release time so they can take time to talk with the observers after they're at the CDCs. And these conversations help our teachers to explain why they did the things in their classroom. And having observed some of these conversations, I can tell you that it's very powerful to watch somebody not only see a technique, but then understand why and how that technique helps children to learn and grow. The grant has also allowed our CDC directors to offer what we call communities of practice groups, where they train other directors in how to best manage a high quality site. And then lastly, and perhaps most importantly, the grant has allowed us to have HDF staff and CDC teachers go on site and coach teachers in using these new strategies and techniques on the job and in their own classroom. This has been super energizing for all of our staff and our teachers because they really get to see where their teachers are and meet them where they're at in their rooms. So we have invested a lot of time into doing this work over the past few years, and one of the questions is why? And I think one of the answers to that, it really has to do with the larger changing landscape in the state of Rhode Island. So DHS has invested tremendous resources in the past few years into a public pre-K program throughout the state of Rhode Island. And this provides parents with high quality preschool education for free through the public schools. But at the same time, it's really important to ensure that the private preschools and the infant toddler education programs retain high quality staff who might otherwise choose to go teach in public schools for a number of reasons. So we end up being part of the puzzle to help train current and new teachers who are entering into the private sector workforce with high quality education. And beyond that, and perhaps the largest overarching landscape, is the importance of childhood in human development. So we know from research that birth through 5 is a critical period for brain development, and in many ways sets the foundation for a number of longer term outcomes, including academic outcomes, social outcomes, psychological outcomes, and even physical outcomes. And in our department, we want to help give our children and our families the best start that they can get. So often we achieve these goals through the language of childhood, which is play. So the value of allowing children the space to learn through play can't be underscored, but in my opinion, unfortunately, sometimes gets lost in the outcome-driven world that we live in right now. And especially at a time where we are seeing such high rates of anxiety in young adults, we think it's really important to start teaching our children when they're really young how to manage their emotions in a productive and a positive way. And so when a child learns on a daily basis how to regulate their emotions, they end up having essentially more mental space to do the demands of childhood, like reading and writing and arithmetic and all of those other things. So in HDF, we feel strongly that our expertise in child development is an important tool for promoting healthy people, healthy families, and healthy communities. And although I've talked specifically about early childhood today, HDF applies this approach across the lifespan in really trying to identify how to promote healthy development at all ages. So with that, I will end my discussion of HDF, and I'm going to transition to introduce my colleague, Dr. Christy Ward-Vertaco. And Dr. Ward-Vertaco is an assistant professor in kinesiology, and she received her PhD and postdoctoral training in kinesiology, or exercise physiology, from the University of Georgia. Dr. Ward-Vertaco's research agenda is focused on examining the independent and interactive effects of physical activity, body composition, and muscular capacity on health-related quality of life across the adult lifespan. She has extensive experience in assessment of these outcomes in midlife women, older adults, and members of special populations, including pregnant women and individuals with Parkinson's disease, amyotrophic lateral sclerosis, or ALS, and dementia. And today she will discuss issues surrounding the application of physical activity to healthy aging. So Christy, thank you for taking time out of your busy schedule, and I will hand it over to you.
Sue, thank you so much. It's such an honor to be here today, and it's such an honor to represent the Department of Kinesiology as well. I am a graduate of the URI Master's Program from our previous department, which was known as Physical Education and Exercise Science. So in addition to joining the College of Health Sciences as a professor, it's been such a wonderful experience to see our major grow into one of the top choices at URI. And also to grow in terms of the people that we service across the lifespan. So it's exciting to be part of the kinesiology program and sort of look at the study of movement as all of my colleagues do. And so I'm a trained clinical exercise physiologist, which means that I generally work with the promotion and application of exercise and physical activity among individuals that perhaps have chronic disease. And how do we apply exercise to minimize the risk for development of chronic disease? But then if you have a chronic disease, how do we help you to live the most healthy perspective lifestyle that you can? And what's wonderful about the College of Health Sciences is that as faculty members, we engage in research, and the breadth and depth of the knowledge among our colleagues allows us to have tremendous support to be able to look at issues for aging adults from a myriad of different perspectives. So we can examine psychological health, we can examine physical health, we can look at physical activity levels, we can look at body composition, we can look at muscular strength and endurance, we can look at gait patterns, and we have individuals across the college who can lend their expertise to let each of these aspects of health be measured in a valid and reliable way. we're all aging right now, so it's inevitable. So it's really our job as individuals to understand that while quantity of life seems to be increasing, the lifespan of the average American seems to be going up. But unfortunately, we don't necessarily see the quality of that lifespan increasing. And as I've done some research in middle-aged individuals, there's actually an increasing amount of adults reporting disability, or an inability to do activities of daily living without undue stress. And that percentage of individuals in middle age, generally considered 40 to 64 years of age, is going up. And that's not necessarily something we want to see, because if we are going to live longer, we'd like to live better. And so one of the challenges of individuals who work with lifestyle behaviors like physical activity is not just showing through research that choosing to be active, choosing to eat well, trying to adopt behaviors that put us at a healthy body weight, that, engaging in those behaviors not only helps us to live longer, but also helps us to live better. And so individuals who are generally physically active tend to report higher levels of energy, lower level, and that's mental energy, physical energy, lower levels of physical and mental fatigue. They also tend to, if we ask them how they feel about their quality of life and their health, they also tend to also report that that's more positive. And the newest version of the physical activity guidelines for Americans show that, movement at any size, of any type, for any amount of time is really helpful at improving health across the lifespan and improving health across any chronic condition that one may have. So I'm very lucky currently to have 3 funded projects that I'm working on with colleagues across the College of Health Sciences. One of the first and most exciting projects was actually spearheaded by Dean Liguori, and a partnership that he created with a company in New England that produces an active assisted cycle. So it's a stationary cycle that has a motor in it, which allows people that may not otherwise be able to achieve higher intensities of activity. And we are going to be looking at how that particular mode of exercise may be able to assist individuals with Parkinson's disease at achieving intensities of exercise that are associated with improved physical function, improved feelings of energy, and perhaps improved cognitive performance after a bout of acute exercise. So once we are in a healthier place in terms of our COVID outcomes, we're excited to have people to come into our lab for us to take a look at how this mode of active assisted cycling compares to a traditional stationary cycle. I'm also lucky to work with colleagues in the George and Ann Ryan Institute for Neuroscience, Kathy Quinlan specifically, on a couple of projects looking at how gait patterns reflect cognitive function, and Dr. Wyant is also a partner on that particular project, along with Susan DeAndrea, who is our biomechanist in the Department of Kinesiology. And so we'll be looking at gait patterns and cognitive function and how those things relate. Additionally, we have a project looking at how muscles function and how well individuals with ALS can produce muscular strength, and looking at their gait patterns. And we're looking to see, are there some physical function assessments, are there gait analyses that we can do that indicate that someone may be at risk for development of one of these particular neurological conditions? One of the challenges with some of these conditions is that once you find out that you have it and you get a definitive sort of diagnosis, it may be slightly late for you to start optimal treatment. And so we're looking for, biomarkers that are early indicators of these particular conditions. And we want them to be non-invasive, that they could be done in the clinic at each of the visits you would have with a physician or healthcare provider. So the resources provided by the College of Health Sciences have been innumerable and immeasurable, and incredibly helpful to getting this research done. And they're very helpful in helping us to figure out what are the best approaches across the lifespan to make sure that everyone not only ages as long as they can, but as well as they can. So thank you so much for your time. I really appreciate it. And I will now toss it back to Dr. Liguori for some summary comments.
Thank you, Christy. Thank you, Dr. Wyant, Dr. Adams, for sharing your information with us. I hope you can all see not only the depth of expertise that we have within the college, but also the connection. I asked these three faculty members here today for a reason, because their work overlaps in some way, shape, or form. Christy mentioned how we look for earlier means of diagnosing a potential problem later in life. And Dr. Adams mentioned how brain development from birth through 5 is critical for the rest of life. And of course, Dr. Wyant's research falls somewhere in the middle there. But it's really clear that everything's connected. So that's the approach we take. That brings me back to the A to Z. And this, again, is just one example. And our three faculty here really are looking at many different health issues, including healthy aging and healthy living. So I don't want to ignore that we really focus on promoting healthy things too, not just looking for disease and disorder. But this is true across our college, is we have this amazing capacity to overlap our work. Each of the three things that were discussed here today, or each of three folks, they also lean on other experts within the college who can measure, for instance, actual activity of the brain in real time, which really complements the work that they're doing. So for example, when Dr. Ward-Bertocco mentions the Parkinson's patients on a cycle, we could actually measure real-time brain activity before, during, and after that to see if the rhythmic nature of the cycle helps modify the brain activity of someone with Parkinson's so that they function better after they do that. So this is pretty sensitive, high-tech stuff, and having this combination of expertise is just instrumental in our success. So we look forward to doing more of these in the future. We'll bring you into some of our labs and actually see them in action, and you'll get to meet many more experts down the road. And with that, I'd like to turn everything over back to Amy. Thank you all so much for spending time with us. We have time to take some questions from our audience. Amy, I'll turn it over to you.
All right, thank you so much, Dean Liguori. I appreciate it. So anybody who has a question, please feel free to enter it in the chat. You can also list your name, major, or graduation year, or any special message you have for any of the speakers or the dean. That would be fantastic. All right, has URI stopped all in-person visits at the moment? Or if the subject has a negative test, can they come in regarding COVID?
Should we ask one of our research faculty to address that? We all have different things. Sue, do you want to give us an update with the child development centers, and then maybe Lisa, you can talk about your research?
Yeah, the child development centers, per the regulations of DHS, are not allowed to have teachers coming in right now, but we have implemented virtual observation. So we're still able to do all the reach outs and the connections that we would like to.
And
Dr.
we are
Lyon.
not,
Sorry, go ahead.
we are not doing in-person research right now, but we are able to continue our research, survey research.
And Dr. Ward-Bertocco, you have a lab that is an assessment lab open to the public. Do you know if they're allowing those with a negative test to come in?
So we work very closely with the IRB here at URI that approves work with human subjects to come in. And so some of the projects that have individuals who would be considered high risk, so individuals with chronic disease, we're holding off on having them come in, but healthy volunteers and all survey work, conducted research work is going on. And our lab manager, Lisa Vincent, she is conducting some of the assessments to the public that we do. So we can't do things like metabolic testing, looking at metabolic gases because COVID is, airborne. But we are doing body composition testing. She actually sent me a picture the other day of herself in her shield and her mask and her gown. So people are coming into our assessment center to have some of those low risk assessments done on their body composition and other aspects of health. So if you have any questions, you can go to our website and email our lab manager, and she'll be happy to let you know which types of assessments are going on. So we're excited to have some of that going on, especially because it allows us to continue our outreach and into the community, and allows our master students who are also trained in these techniques to continue to develop their expertise in these areas.
Thanks, Christy. Amy, do we have any other questions?
We do, and thank you so much, Chris Yoon, for submitting that question. We have another question from an anonymous person who says, is any work being done to connect senior citizens with children for mutual therapies?
Sue, do you want to mention cyber seniors? That's the closest we come, I think, right now.
Yeah, I will take that one. So Dr. Sky Liddell in Human Development and Family Science delivers this amazing program, which is called Cyber Seniors, where she pairs older adults from the community with college students, with the aim of the college students teaching the older adults how to use technology. And so she was doing this far before COVID, but it has really, the importance of this work has really flourished during COVID, because now we have older adults who are needing to do telehealth visits with their doctors and needing to talk to their families on iPads. And so she continues to do this work. I think that's probably the most structured project that we have at URI. But there are also a number of us that have really trying to think about how can we do this in a more structured way. So there are initiatives on campus called age-friendly communities, and we have been thinking about with our child development centers, is there a way to even have older adults coming in and volunteering in our child development centers to play with the children and to do outside tasks with the children, which really will help to promote just healthy development across the lifespan for everybody. So we would hope that we would be able to move towards some of these models in the future.
Thank you, Sue. Amy, are there any other questions?
Yes, we have another question, and this question's for you, Dean Liguori. What can you tell us about interesting research being conducted in the other departments, such as communicative disorders?
I'm glad you picked communicative disorders. That's an easy one. We have a lot of interesting research across the college, but I did mention earlier that we can measure brain activity specifically, and that is actually expertise that comes out of communicative disorders, or CMD. And I think some or all of our guest faculty today have worked with that group. They have become one of our key points of neuroscience research in the college. There also are faculty who do what we call eye tracking research. So that allows the faculty to work particularly with young children and how they acquire language skills, including reading ability. So you can see a real overlap there with what Dr. Adams mentioned about early brain development. Dr. Wyan talked about her work. I don't know if she used the word impulse control, but I think that was implied in some of the things that she does. So a lot of the work coming out of CMD is specific to that. Additionally, and those are some of our new faculty, Dr. Leslie Mahler, the former director of neuroscience, works with Parkinson's patients, particularly in those who struggle with the ability to swallow food and or to speak loudly. So she has some very well-known clinics, and it's interdisciplinary with some nutrition students, some HDF students, some kinesiology students working with the Parkinson's population. And of course, you heard Christy talk about working with the Parkinson's population. So again, emphasizing overlap, overlap, overlap in all that we do.
Thank you so much. We have another question for Dr. Wyatt. Can you share a bit about the inaugural class of students pursuing the bachelor's in neuroscience? Why did they choose this program? Why URI? What are some of their academic goals and professional goals?
So we are thrilled to share that we have approximately 50 students in the inaugural neuroscience program. We're going to have our official launch on October 15th, and Congressman Patrick Kennedy is going to come and speak virtually to the students. So we're excited about that. many of the students share with us that they chose URI. And one of the reasons I know this is because I teach URI 101 for the neuroscience students, one of the 2 sections. And they are excited about the interdisciplinary nature of the program. So all of the neuroscience students will start off for the first 2 years taking the same core curriculum. And then they branch off. They branch off into the College of Health Sciences if they're interested in clinical neuroscience. They branch off to cells if they're interested in cell and molecular. And they branch off to pharmacy if they're interested in neuropharmacology. So they have many options. They have a nice choice of electives that they can take in addition to their core requirements during their junior and senior year. And they also have an opportunity for what we call experiential education. And so they will be working in labs on campus. They'll also be working external to the university to receive credit for those interdisciplinary neuroscience clinical experiences. Was there another part to that question that I didn't
No,
answer?
that was it. You touched upon
Okay.
everything. Thank you so much. All right, we have one more question here for Dr. Adams. As you mentioned, families play an important role in fostering a healthy physical and mental wellness, in their children and for themselves. How has this become a challenge during COVID, and how do you see this changing, how we address these needs?
Yes. So anybody who has children or aging parents knows that this has been a really stressful time. And I think it has really made us have to think about the types of connections that we have and who we're connected to and how we support each other. So, one of the things that I would say is that during the time of COVID, there have been a lot of losses, but there have also been a lot of gains. And I think for parents of young children, we're going to see how strong our children really are. I think sometimes we forget how resilient young children are, and sometimes we put our own worries and our own anxiety onto our children. I'm just thinking gearing up to go back to school and parents being really worried about children wearing masks, for instance, in school. All the teachers that I'm talking to are saying that these young kids are doing a great job with this. So we give them the opportunity to meet a goal, and we see them meet that goal. And I think that's a really powerful message for parents to remember, that this is not ideal, but there is a lot of good learning that could possibly come out of this. And then I think on the other end of the continuum with older parents, I hope that there's more of an appreciation for the amount of help and the amount of people that it takes to really raise a family, and how you rely on grandparents and aunts and uncles and friends, because during this time when we haven't been able to do that because of distancing, I think a lot of people have really come to learn and maybe even better appreciate all of the social connections that we need in order to raise our children. Because like we always say, it takes a village.
Thank you very much. Much appreciated. Dr. Ward-Rataco, as the population ages, what do you see as the increased or maybe changing role of the college?
So I think our college does a great job at engaging the community. I think that we'll continue to do amazing research that, promotes different lifestyle choices that enhance aging. But I also want to point out that URI has an incredibly strong OLLI program, or the Osher Lifelong Learning Institute program, where individuals over the age of 50 can join this organization and engage in classes and field trips and engage with peers in topics, across the spectrum, across URI. And so there are a number of experiential learning opportunities for our students to interact with these older adults, so that they are getting the experience of these adults talking to them about their lives, and then, you know, these younger students are interacting with older adults and sort of giving them the perspective of the current generation. So I think our partnerships with the program in gerontology, partnerships with Ollie, and really, you know, the college has done such an amazing job at increasing the amount of experiential learning that's happening. So we're sending students out into the real world to see what's going on with individuals across the lifespan. So we're not only preparing them academically, but we're preparing them professionally for the world that they're entering. You know, we're at a time where there are more older adults than there ever have been. And as the baby boomer generation ages, we get thousands of individuals who hit that older adult mark of 65 years of age. And so I think the college is doing an excellent job by offering academic programs, as well as opportunities to get out there and really work with the individuals that, you know, they'll come in contact with in their professional life. And I think we're doing that really well across all departments.
Thank you very much. We have another question, this one for Dean Liguori. Someone says they have a child who is starting high school and exploring his options in college. He's interested in public health issues. Is our college a good starting place for learning about the broader area of health, or is the college more oriented to focusing on a specialization?
So that speaks to our breadth, Amy. We do focus a lot on public health. I mentioned our newest department is health studies. They are very much focused on public health, global public health, health promotion, environmental health. And many students see that as a stepping stone to an advanced degree in public health. You can find a variety of expertises in that department, from epidemiology to global health and so on. That department also has now taken the lead on what has traditionally been a J-term travel trip to Indonesia that focuses on rural international public health. Unfortunately, right now those trips are on hold, but nonetheless, it's a reflection of the work that department is doing, in that they can travel to a country like that and do some really amazing things, and then bring those skills back home, either to Rhode Island or their local communities. So public health is an area that we see as a big strength within our department, and we would certainly love to talk more with you and your future college student about them enrolling at URI's College of Health Sciences.
Wonderful, thank you. And one final question, we have just enough time for a final question, and I'll sort of pose it to you, but anyone else is more than welcome to jump in. Looking back over the last 5 years, what are a few of the accomplishments the college has achieved that you're really proud of?
Well, I'll speak from the broader perspective. I think one of the things is that even as our research capacity has grown, we have continued to maintain excellent teaching. Sometimes that gets lost at a research university. I'm looking on the screen at my 3 colleagues and noting that they are some of the highest received teaching faculty in our college and on our campus. So we're very proud of our faculty in terms of classroom teaching, and that we continue to maintain a strength there. Yet at the same time, our research capacity continues to increase, and in an interdisciplinary nature. So those are 2 particular highlights for me.
Well, you looked back, now you know I'm gonna have to ask, what's next? So what are some key priorities in the next couple of years for the college?
Well, I think, as you've heard today a lot about neuroscience, that's a university-wide initiative that our college is firmly planted in the middle of. So we will continue to pursue that agenda, but that's a really broad topic. And again, looking at brain development, birth through 5 versus dementia later in life, and so many other things. So that's an area we will continue to invest in. We have a lot of exciting things coming on board very, very shortly that we hope to introduce you to at a future forum. And I think we want to continue our strong teaching. The neuroscience program will bring more opportunities for us to teach. We do look to add a few programs, but we're being very thoughtful, very strategic about those. The reality is COVID has made us reevaluate a lot of things. And some things will continue to move forward on, and some things we'll reevaluate. But at the end of the day, for me, the main investment is the people that work in the college. You met 3 great people today. We have so many more. And I hope in future forums, I can introduce you to even more of the great people that work in our college.
Amy, may I just add to something that we're proud of in the college?
Yes,
So I think
please.
something that we're quite proud of is the number of undergraduate students that can be involved in research. So all of us have talked today about our labs and our research and working with graduate students, but many, many undergraduate students are critical to the functioning of our labs. And those undergraduates then often go on to graduate school, to medical school, to careers in PT, to careers across the board in College of Health Sciences. So I think URI is very proud, and the College of Health Sciences is very proud of our capacity to be able to offer that for our undergraduate students.
And Lisa, if I can add to that, the college's diversity task force has made the #1 priority this year of providing financial support for underrepresented undergraduate students to be involved in faculty-led research. So we continue that commitment. We're expanding our capacity to support students in that commitment. And again, people like we have here with us today are leading the way on that. So we're extremely grateful for their efforts.
Thank you very much. I turn it over to my colleague, Tim.
Thank you, Amy. And thank you again, Dean Liguori, Drs. Wyan, Adams, and Ward Rotako for sharing such incredible and inspiring work that you are all doing. I hope that our alumni learned as much as I did today. And to those of you in our virtual audience, thank you so much for taking time out of your busy day to join us. Please keep an eye out for future programs from the College of Health Sciences. As I said before, you can really show your Rhody pride and your Rhody spirit this week to provide immediate support for today's students through URI's Day of Giving on Thursday. We will send instructions for making your gift, as well as the recording of today's session in the near future. Thank you again, and go Rhody.